Welcome to North Central Healthcare. My name is Michael Loy. I'm the Chief Executive Officer here at North Central Healthcare, and I've been in this organization for about 4 years. But I'm here today to tell you a little bit more about our campus and our $67 million renovation plan that we're proposing to reinvigorate and really reinvest in this campus for the next 30 to 40 years of our community. If you don't know much about North Central Healthcare, our history actually stretches back as far as 1892 on this campus with the original Marathon County Asylum for the Insane. The cornerstone next to me says dedicated to the cause of humanity. That mission is true as much today as it was in 1892, and it's the tie that binds together this organization. Over time, we've evolved into our 3-county partnership, and this campus has evolved along with it. The last major reconstruction projects here on our campus occurred in 1986 with the building of Mount View Care Center, but the main part of the healthcare center that I'm sitting in today was built in the early 1970s and is fast approaching 50 years old. We've had another part of our campus called the Lakeview Center that was built in the late 1970s that includes the aquatic therapy pool, which all of you are very familiar with in terms of that project moving forward on this campus here in the near future. So simply put, this campus has a lot of needs, as the last major construction project was 32 years ago. And a building that's 500,000 square feet has a lot of parts to it. And as you start to think about the future of the campus and what we can do with it, it takes a lot of time and thought and energy to think about how we do this to best serve our community's needs. As you go around the campus today, one of the things that you'll notice is that while the design standards from the 1970s were contemporary at the time, our design needs, environmental care needs have changed quite considerably since then. We will continue to be more and more of a community-based organization and operate outside of our walls, but here within our campus, we really do need to have that 24/7 core that can provide a very comprehensive continuum of care for people that need that full continuum of residential type care. So we're here today to show you some things that we're trying to address through our master facility plan, but overall you'll see that this organization is very spread out, inefficient in its design today as things have changed, and certainly has an institutional feel. As you look down the hallways from right here, there are a number of different ways that you can get lost in this building. Patient wayfinding and point of access is a key part for us. A little fun fact, this campus has 113 doors to get into it. And when we get done with our project, we believe we can get down to 3 points of access to where our community can clearly access our services without knowing the full scope of services that lies behind that door. So one of the visions that we have for this organization over the long term with this master facility plan is to get all of our community-based mental health and addiction services in one location. Today when you walk into our campus, there is a number of different ways you can access those programs from the outside, but also internally as you walk in and navigate our hallways. We believe fundamentally that an individual with mental illness or addiction should be able to walk into this organization, be able to go to one point of access and one reception desk and say, I have a mental illness and addiction and I need help. We have a number of programs that we can help them with from there. We do community treatment programs, our OWI assessment and treatment, day treatment, counseling, intensive outpatient, and all those programs can be behind one set of receptions and point of access. Today that's not the case. As you see, we'll walk through some different parts of these programs and you'll see that not only are there long hallways, but they're located in 4 different areas currently on our campus, which requires quite a bit of infrastructure to be able to support those locations. As we've changed as an organization and grown, it's necessitated us to pop up offices so that we could have staff throughout the building on our campus. Our vision long term is that all of these programs will be in one area, and then truly an individual can walk in and have all their needs met after they're able to connect with resources and be referred in the appropriate program based on their current needs. As you go through these programs, one of the core dignity issues that we have is the number of our patients that come into our outpatient treatment, because this is a cinder block built building, walk into an outpatient therapist office and you can see that it feels like a cell block. And we've had a number of individuals from the criminal justice system that have really had a challenge with this. And as you see, as we go through these programs, not only are they not conducive workspaces where no natural light is coming in during the day, but there's a lot of solid cinder block walls that staff have to look at for 8 hours a day. Obviously, the environment of care and the environment that people work in every day matters to their overall mental health. And so we'll take you through and you get a chance to see what most of our staff and our patients get to experience on a daily basis in our campus as it currently stands today.
As a counselor here at North Central Healthcare Center, I feel it's very important for our clients to feel comfortable in the space that we do counseling with them in. As you can see, I've put up some pictures, tried to make it as comfortable as possible for my clients that come to see me. I have noted, however, that a couple of them, when they came into my office here at the Wausau campus, who were used to meeting me with in an office that had a window, said that they felt like they were in a jail cell, and I really felt, wow. I always had the impression that our environments are very important for our clients, but I really never realized how much effect the surroundings could have on a person. So as a therapist, I felt like it was very important to bring in pictures, but I definitely feel like it's very important for my clients to have that feeling of comfort and openness as I try to help them.
Welcome to one of our main rooms for our physical plant where our boilers are located. These are our 1970 boilers. Today they run about 60% efficient. And a 500,000 square foot campus, you can imagine how much energy is lost. If you were to build a boiler physical plant like this today, it'd be about a fourth of the size and over 90% efficient. Obviously there's some money to be saved in efficiencies in this master facility plan that we're looking forward to doing. So this is location 3 of 4 of our community-based mental health services. And then we walk in and look at the office layout. Obviously we're just trying to put people wherever we can find an office for them. But if you're somebody that's trying to seek our services and you walk in to find our community treatment for youth program, it's going to tell you to please check in the reception. That's about 1,000 feet the other way through the hallways if you can find it through a separate entrance. So obviously these are part of the challenges that we're dealing with today. So our campus is situated on 17 acres of land here. And while we have a beautiful property along Lake Wausau, there are some challenges in the way that the campus is laid out. Today, if you walked in this door to enter aquatic therapy services, you'd be able to gain quick access to the pool. But if you're a resident of Mountview Care Center and you want to come down and use the aquatic therapy pool as part of your rehab or your daily activities, it's going to be quite a walk. So we're going to take you on our walk from one end of the campus to the other to give you a perspective of just how much territory and ground we have to cover on a daily basis. What you see here is our conceptual drawing of what the renovation for the $67 million master facility plan is for our campus. A major component of this renovation is the $25 million component of Mountview Care Center, the nursing home here at North Central Healthcare. On this drawing, you see there are shades of white that denotes the new parts of the building, and then the dark parts are the current building. And so what I want to do is give you a perspective from the outside of what that's going to look like. And so today, where we're standing here on our campus and on our parking lot will be the reach of this new build-out and entrance to Mountview Care Center. So this entrance will be one of our 3 entrances people can access. So if you want to access skilled nursing services or the aquatic therapy pool, you'll enter through this door and be able to enter those services without having to go through long hallways. As you look over at our campus here, we'll have a long walkway that will connect that entrance to our outpatient and community-based mental health services. That walkway will extend over to this new part of the entrance for Mountview Care Center. So if you go in the wrong door, you'll be able to walk indoors on a straight shot to the other main door that we have on the front part of our campus. Right in this space here will be where the new aquatic therapy pool will be laid just behind will be that walkway connecting those 2 doorways. But you'll have 2 stories as an extension on the front part of this building. The second story will be our therapy services, and the first story will be the community center and the resident living area that will connect to Mountview Care Center and the major renovations. One of the major concerns for the community is how much of this master facility plan is going to encroach upon the beautiful campus that we have that this neighborhood and community regularly enjoys and comes out and walks through on a daily basis. I'm here to show you that the master facility plan in the new renovation part of our building will stop right where I am and extend over into our parking lot. So as you pan through, you'll see that our soccer field that we have for the community and the residents, and all of the trees that are historic here to this campus will remain at the end of the day. Marathon County has been providing skilled nursing services since 1916 with the Ribview Sanitarium. At the time, the skilled nursing beds were built to care for individuals with tuberculosis. Over time, the Ribview Sanitarium and the Healthcare Center has grown to add beds in the continuity shift to meet the community's evolving needs. As modern advances in tuberculosis care happened in the 1950s, the 200 beds at the Ribview Sanitarium converted over into traditional long-term skilled nursing beds. Here in the Healthcare Center, in 1971 when this campus was built, we had a number of long-term stay beds as well. And over time, into the 1980s, at that point we had over 400 skilled nursing beds that were licensed here in Marathon County. At that time, we decided as a county that we needed to consolidate our operations to be more efficient and bring all 400 beds onto this campus and decommission the Ribview Sanitarium beds that we had on the west side in the industrial park. That led to the creation of Mountview Care Center that is known today. And when that part of the building was built, we did have over 400 people living in this building. As the community's needs have continued to change and healthcare continues to evolve, more and more people are seeking care in their homes longer or are able to be discharged back to homes sooner. And so our bed count here has changed considerably over the last 5 to 10 years. At one point, over about 5 years ago, we were around 240. Today, we're operating about 185 census in terms of our beds here on Mountview Care Center. So as we look at our master facility plan, not only are we trying to build a facility that meets the community's needs, but we're trying to evolve ourselves as an organization into what the community wants when they come into a long-term care facility. And truly that's a dignity issue because while it was okay in the 1980s for individuals to have semi-private rooms and to share bathrooms, that is no longer the case today in 2018. And so, quite frankly, we have a number of individuals that come to this organization and choose other providers in the community when they're able because of the aesthetics, but they often come back because of the high quality care here at Mountview Care Center. So we think we can accommodate three things. We can meet the community's needs through a stable census, we can have a high quality environment of care, and we can have really a modern facility that leads to improvements in infection control and just overall patient experience and quality when individuals are here at Mountview Care Center. So as we look forward to the master facility plan, we obviously have too much space on our campus. We'll walk you through down a couple halls. In early 2017, we closed a whole wing of Mountview Care Center because the community didn't need that many beds for long-term care. So as we look at Mountview Care Center and the renovation, it's going to require heavy renovation, but we're going to be able to stay within our current footprint and be able to use the four walls that surround us and really continue to have access to the high-quality external environment and views of Lake Wausau. We think that's an incredible part of our asset here on this campus. But what we'll be able to do is shift to 16-bed neighborhoods that are really truly more of a home-like environment with private rooms and private bathrooms and truly a whole different way to experience care here that is contemporary with 2018. So welcome to our therapy space here at Mountview Care Center. This therapy space is very small for the needs that we have here. There are a number of individuals every day that need rehab, dozens and dozens that need to come in and be able to use this space, often half a dozen or so at a time. And so what we need to do is be able to expand this space and offer other modalities to help people in the rehab process to be able to help them get back to the higher functioning that they're seeking and get them back into independence and out, hopefully back into the community. Welcome to our crisis stabilization room here at North Central Healthcare. As part of our behavioral health services, emergency and crisis services is a huge component of our ability to be successful in the community, meeting the needs of individuals with mental illness or addiction that are in crisis. Often individuals will come in from the community in crisis, and the start of their journey here with North Central Healthcare will start in a room like this. Our stabilization rooms, we have 5 of them today, and we are very busy during the day with a number of different crisis assessments and individuals that need stabilization services. Obviously, as you look around the room, it's a very sterile environment, and we think we can improve the quality environment and have higher success in stabilization. From here, an individual accesses all of our 24/7 behavioral health services, most predominantly our inpatient psychiatric hospital. We're going to show you today one of the challenges that we have with our inpatient psychiatric hospital, which is that it is a semi-private room environment. One of the worst days I had as a CEO here at North Central Healthcare was when I unexpectedly was sitting in a community interview and a presentation by a community member that had experienced our services and talked about how traumatic it was for him to be on our unit and sharing a room with another individual while he was trying to work through his own mental health crisis. So as we go onto the inpatient unit, you're going to see rooms with 2 beds and up to 4 beds in 2 of our rooms. Obviously in 1970 there was a different world that potentially that was a more conducive way of providing services. Today that's not the case. In private rooms in a completely different environment of care for an inpatient psychiatric unit will enhance outcomes and will overall reduce costs and increase services to this community. So as we go into the hospital today, you'll see some of our limitations, not only with the size that we have, it does not have access to an outdoor environment, but also our crisis services are very condensed, and as we've expanded those services, we have a number of workers working in very small spaces. So we need to greatly expand these programs and services and the footprint to, again, lower costs, improve revenues, and most importantly, improve outcomes for the people that we're serving. Welcome to one of our rooms in our inpatient psychiatric hospital. As you can see, this is a 2-bedroom, so you can get a sense of what it would be like to be in this inpatient psychiatric room if you were a patient here at North Central Healthcare. As you look around the room, you'll notice that there are cinder block walls on all 4 areas. There's very little natural light coming in, and obviously you have to share both a bedroom and the bathroom with another individual who you don't know and may be really struggling in their detoxification or their mental health crisis. I want to thank you for taking time to walk through our campus and understand some of the needs that we can address through this $67 million renovation. Well, that's a lot of money, and we're talking about bricks and mortar. This is more than that. A master facility plan in our renovation going forward is going to be essential to our ability to operate and be financially viable, but more than anything, it creates an environment that will be more engaging and welcoming to this community so that we can continue to serve the community as we do today and even in a greater regard as we move forward in the future.